Thank you, Mr. Chairman, members of the committee. I wanted to first start by giving you an idea of my practice environment, because I don't work in an inner city or a highly urbanized area. I work in a suburban emergency department that sees approximately 45 to 50,000 visits a year. We also function as a satellite children's facility, so we see approximately 40% of our volume are children. And I want to tell you that even in our sleepy suburban community, which I believe is typical of almost every community in America outside of the urban setting, I'm in an environment that continues to be understaffed. We are underfunded. We are overworked, overwhelmed, and overcrowded. And I want to address each one of those things for you. First of all, let me give you a story. It was interesting listening to Dr. Schwab talking about his experience. Because my experience is a little bit more profound than that. Because one day when I was working in the emergency department, a frantic mother brought in a child who was choking to death and was blue. And I did not even have a single bed available in my emergency department. I debated for a few seconds, should I just put the child on the floor in order to try and open the airway. Did not even have a bed. And fortunately, because of the dedicated staff that we work with in our emergency departments, nurses, technicians, they were able to scramble a patient out of a bed and pull the bed over to the middle of the emergency department hallway, where I proceeded to pull an apricot pit out of this child's trachea. Now, it struck me then and there when I looked up, and you know how these things go, you're kind of a little adrenalinized at that point. You look up and you see about 30 people looking at you. Most of them are patients. Some of them sitting with their gowns that are kind of open in the back. So it always makes for an interesting sight as well. I'm here to tell you that even in my sleepy community of Mission Viejo, California, a suburban area, there are days when I don't have adequate resources to take care of patients. One of the big problems that we are facing, I think, in this country is an explosion in the volume of patients we're seeing. In my area, for example, we've had tremendous growth in population because of construction. And I understand that we're not the only area of the country that's seeing that kind of explosion. But one of the problems that we're seeing is the lack of infrastructure to help support that explosion in population growth. So as a result, we are confronted with the issue of overcrowding every day. We have a situation where we also have patients that are literally living in our emergency department for more than a day at a time. We have psychiatric patients sitting in our emergency department because we cannot get resources to them or their beds in my immediate area to send those patients to. Most people have this misunderstanding about overcrowding in emergency departments. I'd like to dispel that myth once and for all here in this committee. Overcrowding in emergency departments is not due to patients who have minor problems coming into the emergency department. It is due to patients who are sick sitting in beds in my emergency department when there are no beds, no capacity in the hospital to get them upstairs. So I can't get new patients back into my emergency department. That means that I have to contact my charge nurse and let her know that when I don't have any beds any longer, because they're full of inpatients in my department, I have to let her know the ambulances cannot come here. So that means although we are a cardiac receiving center where I have a cath lab available 24 hours a day to take the sickest cardiac patients in my community, I cannot get them into my hospital because I don't have a bed for them. So I have these tremendous capabilities, tremendous talent, tremendous dedication, and I cannot get these patients to my facility to take care of them. All I ask of you, and all I ask of this committee and of the federal government is to help me do what I do best, and that's save lives and take care of patients. I cannot do that unless we have the resources. I think the Institute of Medicine report laid it out very clearly that we are underfunded, we don't have adequate resources. We're talking about a surge capacity. There is no surge capacity left within our hospital environment. By the way, my hospital is located approximately 30 minutes north of a nuclear power plant. And I can guarantee you if there's any place that needs surge capacity, it's my facility. It just does not exist. Let me just summarize by saying the American College of Emergency Physicians has, over the last few years, brought this attention to everyone we could possibly bring it to. We've held a rally on the lawn of the Capitol. We've had surveys that have been put together. We've even introduced a bill, the Access to Emergency Medical Services Act of 2007. And I know this is an oversight committee, but the fact of the matter is that we are making every effort to try and come to solutions that will help solve this problem. But once again, my sleepy community town is, I think, average America. And if we are seeing the same problems that the urban and suburban environments are seeing all over this country, then I think we should all be very, very afraid of what's happening. I think we really need to do something and do something quickly. Thank you.
Thank you very much, Dr. Johnson. Dr.